Pain around the navel is very common, and medically it is called peri-umbilical pain. Anatomically, the small bowel is located in this region, which is why most cases of pain in this area are caused by small bowel related problems. The first and most common cause is functional intestinal pain, also known as irritable bowel syndrome, which is called IBS. It accounts around 50% of peri-umbilical pain in adults. Blood tests are usually normal. It is very common in young and middle-aged women and is usually associated with stress and irregular sleep. The pain is typically cramping or pressure-like. It comes and goes and often relieved after passing stool or gas. Symptoms are sometimes worse after meals or after stress. IBS is especially common in office workers who live with chronic stress, irregular eating, low fiber intake, and poor sleep. This condition occurs because the body perceives normal bowel movement as pain, and stress hormones amplify nerve signaling in the bowel. The second most important cause of middle abdominal pain is early appendicitis. The second and most important cause of middle abdominal pain is early appendicitis. It is not very common, but it is very important because it's an emergency condition. Appendicitis is more common in children and young adults. The pain is usually dull and deep, and it becomes consistent and constant over time, often associated with loss of appetite. The pain typically starts around the navel and moves to the right lower abdomen within several hours. Nausea often follows the pain, not precedes it, and this migrating pattern of pain is one of the most crucial diagnostic features. Treatment is usually surgical removal of the appendix with antibiotics used as supportive therapy, and the prognosis is excellent when emergency treatment is provided promptly. The third most common cause of middle abdominal pain is small intestine spasms or early small bowel obstruction. It's more frequent in elderly population and in people with hernias. The pain is usually severe cramping and comes in waves and is often associated with nausea and vomiting. Vomiting may temporarily relieve the pain, and imaging studies typically show dilated bowel loops. These symptoms commonly require hospital observation, and the surgery is required if the obstruction persists. The fourth most common cause is acute gastroenteritis, commonly called stomach flu or food poisoning. It is very common, especially in children, young adults, and travelers, large families, and people living in dormitories. The pain is usually cramping and twisting, often accompanied by watery diarrhea, nausea, and sometimes vomiting. Fever and body aches may occur, and bloody diarrhea suggests a bacterial infection. This condition typically develops after consuming undercooked meat, unwashed vegetables, contaminating food or water, or due to poor hand hygiene. The main treatment is oral rehydration, given in small and frequent amounts, especially in children, to prevent dehydration and severe complications. Fifth most common cause is constipation with stool retention. It is very common and causes recurrent mid-abdominal pain and bloating. It's frequent in people with low fiber diet, low water intake, a sedentary lifestyle, and those taking constipating medications. The pain is described as pressure, fullness, or discomfort that improves after bowel movement. It is typically central, intermittent, and strongly linked to bloating. The sixth most common cause is inflammatory bowel disease, such as Crohn's disease. It is less common than functional pain, but important not to miss. Inflammatory bowel disease causes deep, aching, crampy pain, usually worse after eating, and is associated with diarrhea, fatigue, and sometimes weight loss. The disease is chronic, and chronicity is a key hallmark, with symptoms lasting weeks to months, Red flags include unintentional weight loss, fever, blood in stool, and night symptoms. C-reactive protein and fecal calprotectin may be elevated. And colonoscopy with biopsy is required to confirm diagnosis. With proper treatment, the prognosis is favorable, while untreated disease increases the risk of complications. And seventh most common cause is abdominal wall pain. This pain is not caused by internal organ damage, but by abdominal muscle pain related to heavy lifting, core workouts, prolonged coughing, and postpartum state, minor trauma, or previous abdominal surgery. The pain is usually superficial, and the person can clearly localize it with one finger. It worsens when the abdominal muscles tense, such as sitting up, turning, or coughing. The prognosis is excellent, and most cases resolve within several days. And the eighth most common cause is umbilical hernia. It is common in general population, but the pain is less common. Most people notice a visible or palpable bulge at the navel. It is more frequent in overweight adults, pregnant, or postpartum women, and people with chronic cough or heavy lifting. The hallmark is bulge that may come and go. A danger sign is when bulge becomes hard, non-reducible, especially with vomiting or severe pain. In many cases, surgical treatment is required. And ninth most common cause is gynecological causes in women, such as ovulation pain, ovarian cyst rupture, or pelvic inflammatory disease. Ovulation pain is usually one-sided, but it can be felt centrally. Ovarian cyst pain may be sharp or aching, while pelvic inflammatory disease causes deep pain, abnormal vaginal discharge, and sometimes fever. Sudden severe pain with nausea raises concern for ovarian torsion, which is emergency condition. A pregnancy test is essential in women of reproductive age. These gynecological conditions are usually assessed with imaging tests. Ovarian cysts, if not ruptured or complicated, can be often observed. Pelvic inflammatory disease requires antibiotic therapy, and ovarian torsion requires urgent surgical evaluation.